Hi, my name is Natalie, and this is going to be my victim. Her name is Stacy, and we're going to be going through AED of an adult, and then differences of a child and infant at the end. We're going to go ahead and, of course, check the scene for safety, do check call care, and that's whenever we would, of course, request somebody to go ahead and retrieve the AED for us. While that person goes and retrieves the AED, we're gonna go ahead and continue care with the victim. If the victim has no pulse and they need an AED, they of course need CPR while the AED arrives on scene. Once the AED gets on scene, we're gonna ask that person to go ahead and open it up and turn it on. Once the AED is turned on, we're gonna go ahead and follow the instructions of the AED. Go ahead and place the pads. So once the pads are in place, they are plugged in and ready to go. And once the AED tells us to stop doing compressions, we will go ahead and step back from the patient, make sure nobody is touching the victim. It'll analyze the victim and it'll determine if it needs to be shocked. Once the victim has been shocked with the AED, we're gonna check for signs of life. Then we're gonna go ahead and do the head tilt, chin lift, give 2 slow breaths, and continue CPR until the AED tells us ready to give another shock again. The AED should count for you, give you the beats that you need to go, the beat that you need to go at, and it'll inform you when another shock needs to be given. The only difference that is for a child and infant compared to an adult is the pad placements. Usually the AEDs will come with different size pads, one for an adult and another one for child and infant. For the child pads, you would typically place them on the same place as you would an adult, but if the pads touch, then we will go ahead and have to place one on the lower left chest, another one on the middle of their back. For infants, their pads will go on the center of their chest and one the center of their back.